For the record, there's a copy of the Open Meetings Act here in the room if anybody wants to see that. Also have official notice of the public meeting. With that, I will ask for a roll call.
Here.
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 You got Lauren online. You got Deputy Chief Gray online.
Selena?
Okay. All righty. With that, we'll go to item 2, which is approval of the minutes for the April meeting. Is there a motion to approve?
So moved.
Motion by Gray. Is there a second?
Second.
Second by Wilkin. Roll call.
Yes.
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 Abstain.
Yes.
All righty, there's an opportunity here for public comment. If anybody in the room or online wants to make a comment, are there any public comments at this time? And I am looking here online to kind of make sure. Seeing none, we're gonna skip item 4 and go to 5, just because the action item materials didn't get sent, and we're passing them around for the board members if you got any questions. So with that, we'll go down to Dr. Hughes and how she wants to proceed with item 5.
All right, good morning.
Morning.
Good morning.
I'm going to flip this around just a little bit. We'll do state of public health last, if you don't mind, and that way we can get some of our other things taken care of first that won't be quite as complicated with computers and things like that. So we'll start out with just a report out with what's going on from a personnel standpoint at the health department. I have a number of retirements to announce to you this morning. Alma Domenico, who is our secretary in the WIC program in health promotion, submitted her resignation, and her last day will be next Friday, the 27th. Alma's been with us for quite some time, and I know does so much to keep both WIC and health promotion moving in the right direction, and her absence will certainly be missed, and we really wish her the very best in her retirement. We're going to miss her a lot. We have another retirement coming up, also Friday, May 27th, and that's Christine Scott. She's one of our environmental health specialists. She is in the food safety and compliance section and has been one of our food inspectors for some time. And I know that we're going to miss her a lot too. Our food inspectors do so much to educate the community about food safety and proper food preparation and sanitation. And so we're just really going to miss her expertise on our team there. And finally, I have to announce to you the retirement of Tim Kelso, our finance and administration chief, and his last day also will be Friday, May 27th. So next Friday is going to be a hard day for the department, losing so many fantastic people. I do want to take a moment to just thank all 3 of them, and Tim especially, for the last 15 years that he has been with us to keep all of our administration and finance activities moving forward. He's brilliant from a fiscal standpoint. He handles so many of our administrative things just very deftly, and his absence is very much going to be felt. So Tim, Christine, Alma, thank you so much for everything that you've done for our department over the years, and we wish you the very best in your next adventure. I also have another resignation to let you know about. Erica Colbert, who is our emergency response coordinator right now, has accepted a position elsewhere in town, and her last day is this coming Friday, May 20th. So we are unfortunately losing some really fantastic people. We do have a few new people coming on as well. We've had a couple new people who started in April. In health promotions, we had Delia Lerma start. She's a community health worker, so we're excited to have her on board. In the public health clinic, our clinic clerk, and as you remember, that position was open for quite some time, was filled by Myrna Bennett, so we're very excited to have her as well. And then we have a promotion. Alejandra Reboledo accepted our supervisor position, and she started on Monday, May 16th. So we're very excited to have Allie on board. Allie was one of our disease investigators previously. She took over supervising the COVID information line for a while, and she is now promoted into the supervisor position, and we know she's gonna do a really great job there. So right now, we've got 13 positions that are either vacant, are going to be posted soon, or have been reposted, or might be in the interviewing or hiring process. So we've got a public health nurse in TB, an air quality specialist over in the lab. I know that there have been some interviews there. Our fetal infant mortality review nurse position is still open. We have a secretary position in lead, food and drink, and WIC. So would love to get that one filled. Our supervisor for environmental health is going to be remaining open for a couple more months, so you're not gonna see any movement there until probably July or August. We do have an interim supervisor who is acting in that role right now though, so we do have somebody who's backfilling. Our senior epidemiologist role, as you know, Ann O'Keefe left last month. That's open. We now will have 2 emergency response coordinator positions open, and then the division chief for epidemiology and emergency response, which hopefully we will be able to get some interviews going on for very soon, and then the division chief for finance and admin, and also the deputy director. So we have a number of positions open right now, and we hope that people out in the community who might be interested in working in public health will go out, check out those applications or those positions and put in their application. With that said, I do have someone to honor today. So Miss Emily Ortner has been with us for 20 years. So Emily, come on up. And I think that I might have left off part of your last name. I'm very sorry for that. I know you as Emily Ortner. Emily Schlichting Ortner. Thank you very much. Emily works in our health promotion area as one of our community health educators, and 20 years with us. So she is definitely someone who has a lot of knowledge about the organization and kind of where we've been, and she is just a fantastic person for our community to work with and for us to have on board for that long. So Emily, thank you. Thank you. All right. Yes, and Patty Falcone is her supervisor. Do you have anything that you would like to say? You can come up if you'd like. I don't think Patty likes microphones, so it's all good. She would say that Emily is fantastic, and we're just very glad to have her. So thank you for all you do, and we look forward to continuing to work with you in the future. All right. With that said, let's go ahead and move into COVID. And you'll have to forgive us as we continue to work out all of our little quirks here, but it's going more smoothly than it did before, so we're happy for that. I have shared the screen. It's not popping up there, though.
So there you go.
Yes. Oh, there it is. Just took a minute. All right. So we've had a nice little reprieve from talking too much about COVID, but unfortunately, we probably need to start talking about it again just a little bit more. My hope is that we're not going to have to do that for too long, but we don't really know. This looks a little bit different than the main page of the dashboard that you've seen before, and that's because we've updated it a bit so that we can fit a little bit more at a glance information on that initial landing page. So that's going to look just a little bit different for you. I'd like to draw your attention to two specific places. First, the chart, this purple line graph that you see on the upper left corner of the dashboard. So as you can see, and I'm going to zoom this in just a little bit, this shows the entire trajectory of the pandemic, but we can zoom that in just so we can get a little bit better idea what's happening more recently. So we're still sitting at low community levels according to the CDC, so that's really good. We'd like to stay as close to low as possible. However, you can see that we are starting to increase in case numbers just a bit. So this week we did finally top 100 cases per 100,000. We'd been sitting down in the 30s and 40s and 50s for a little while, and we were all very much enjoying that. However, we are seeing more cases happening. That is not necessarily a surprise. We've seen case rates increase across the nation, so that is not something alarming necessarily. It's something that we expected to see. However, even with those increases that are happening right now, we still are at that low level for the community, and that is based on how the CDC breaks up basically and measures cases and hospitalizations to predict the transmission levels in a community. So that's a good thing. And if you ever have questions about what that actually looks like, there's a link down here that you can visit, and that will take you to the CDC where you can see all kinds of community level information. They only update that weekly, so it may not be as up to date as our dashboard. Vaccination status right now, out of all Douglas County residents, we're sitting at 67%, and for those who are eligible for vaccination, we're at 72.3%. So we do continue to creep up very, very slowly at this point. Again, that's not something new. That's also a trend that we're seeing across the state and across the nation. Vaccination rates have been moving fairly slowly as case rates have decreased, and I think that the seriousness of the situation, people have kind of tried to take a breather and maybe not think about COVID so much. But since we do have increasing rates, we do encourage people to get out there. If they haven't gotten their initial series, it's not too late to do that. They can still do that, and then if they're eligible for a booster, to go ahead and do that. We've had over 1,100 deaths over the course of the pandemic related to COVID-19. And in total, we've had 151,696 cases. So that's just a very quick down and dirty of where we are sitting. We also added a reinfections tab to this dashboard that I wanted to highlight quickly for you. And the reason for this is, initially in the pandemic, we of course weren't seeing reinfections because it just hadn't been around long enough for that to happen. But now that people have waning immunity depending on when they had COVID, we are now seeing some reinfections. This is not a super common thing, but it certainly is happening. So basically, you can zoom and you can see when we were having our Omicron spike, which is this nice curve that you're seeing here, if you see the dark blue that is down at the bottom, those dark blue ones are the reinfections. The light blue ones are the initial infections. So you can see of all cases reported, reinfections remain fairly low. But that is something that we're certainly keeping track of, and of course that is important information for people to track from an epidemiological standpoint, just so that we can better characterize kind of what happens with COVID over time. Hospitalizations related to COVID are also starting to go up a little bit. Wait a second for the graph to pop up here. This also looks a little bit different. So first of all, the line graph on the bottom left looks familiar, I'm sure. That is the total number of patients in the hospital or on ventilators because of COVID-19. So you can see that hospitalizations related to COVID-19 are going up. Our ventilator usage, thankfully, has remained low. So that signifies possibly, while the cases that are in the hospital are serious, hopefully they're not progressing to such seriousness that they need advanced support for that. And then over on the bottom right and the middle, you're gonna see these kind of jagged charts here. And what you're seeing is actually bed occupation or beds available compared to how many beds are actually being occupied. So you can kind of eyeball the space. So if you remember, really looking at our capacity was a big thing that we were tracking previously in the Omicron spike, and wanting to know how close we were getting to running out of hospital space, if you will. So you've got a couple different things here. You've got medical surgical, which is a less acute or less severe level of care, if you will, so people who don't need quite as much care. And then over on the right, you have ICU beds. So you can kind of eyeball and see how that's looking in terms of capacity. So you can see we still have, there's a gap there between the top of the gray line and the top of the blue or yellow line. So that's good. That means we still have some capacity in our hospitals. So those are things that we'll definitely be keeping our eyes on as we kind of see what this current wave is going to look like, if you will. I gave you a very quick update on vaccinations, but I'm gonna pop over here real quick just to give you a little bit of a breakdown and kind of show you what's happening there. So you're gonna continue to see that our doses given remain somewhat low. In terms of being fully vaccinated, we're getting there, but it's again, fairly slow. And then I wanted to point out to you by race and ethnicity down at the bottom center, and you'll see that our Black population and our Native population both are lagging behind other race and ethnicity groups in terms of vaccination. We do continue to work closely with our community advisors in North Omaha, South Omaha, refugee groups and such to hopefully continue to bump those up, and those are just very slow to improve, but we're working on that. All right, so one question I'm sure people have is, what about the 0 to 5 kids, and when is that going to happen? My understanding is that there will be meetings in June to discuss that. I think there are 3 meetings that are scheduled to discuss that at the federal level, so hopefully we'll have more information for you coming forward after that. Does anybody have any questions on COVID-19 right now?
Let me ask a little bit, Dr. Hughes. How are we, I'm sure there were, before home tests, there were a degree of people that weren't getting tested out there gambling, but how are we factoring in the variants that we know may not be reporting based on the fact that you can get a take-home test?
So how are we able to track different variants when you have people testing at home?
Yeah, because let me give you an example. So like, I was around somebody I heard was positive. So I took one of the tests and it was blue, but I couldn't tell the difference in the line. So I took another test, the tests that were outside the health department. So I took some of those. That test, you have to fill out something online, which registers, so I guess it registers you, and it was clean cut, no negative. So I'm just trying to figure out how we got this. Is there a, like say you take a political poll, there's 4 to 5% variance of accuracy? How, are we doing anything to gauge that?
There are ways for people to report positive home tests to us, so that is something that's in place on our website. We know that not everybody is going to do that, and we don't necessarily investigate those cases, but we do gather, what information we can. Honestly, I can't give you that number off the top of my head. That's not something we're putting on our dashboard necessarily, just because we know that it's not something that's going to be consistent. You're going to get a portion of the population that reports and a portion that doesn't. I also took a couple home tests, and I never reported that they were negative, but there are ways for people to report those positive tests if they'd like to.
So, but we can't say, like, again, using that example, if you were seeing a political poll, you would say that this person's leading 47, 41% with a 4% rate of error.
Yeah.
We don't have.
We don't have that
we
right
know
now.
that, but we know that there's a rate of error out.
Yeah.
Okay, all right.
Great.
All
All right. Well, hopefully that wasn't too much of a day ruiner to look at COVID rates going up a little bit, but hopefully this is going to, turn into something where we're seeing more gentle waves than big tsunamis of cases. So we'll just have to wait and see as this develops. Is there anything that the board would like to ask or bring up before I go into state of public health? All right. Then let's do it. Okay. I first need to give a shout out to the team of people who helped put this report together. It was such a wonderful experience having a team of people who actually work on data and give good information instead of having to go out and pull and calculate all of that myself. So I just want to thank all of the people who even put slides together. Thank you very much, guys, for that. So this is State of Public Health 2022, and this is going to probably look really similar to previous year's State of Public Health, but I also want to talk to you about some vision going forward for what this report might look like for you. But before we get to that, we'll go ahead and just go through where we are right now. So I do also want to kind of preload this discussion with the fact that a lot of these numbers are preliminary, so we don't necessarily have complete population data. The pandemic has thrown off a lot of our regularly scheduled things like getting population data. You used to be able to assume that you'd be able to draw that by a certain date or a certain month in the year, and things are just very much in flux still. So we used what we were able to get, so some of these are estimates, which you'll see noted on the slides. And before we do that, it's going forward instead of backward, sorry. Well, we'll start with infant health anyway. So infant health has been one of the areas for intervention that Douglas County Health Department has looked at for many years, and for good reason. We know that infant health is foundational to really how healthy and how well your community is going to do in future years. So if you can intervene at really early levels and keep your babies healthy, they stand a better chance of being healthy as they go across the lifespan. One of the measures that we look at for that is, of course, infant mortality. The goal for infant mortality as set by Healthy People 2030 is 5 per 1,000 live births. So that's not 100,000, that's 1,000. And where you see results here, you're actually going to see a graph here in a minute, so that'll be a little bit easier for you to read. But the bottom line is that while we were decreasing for about 4 years pretty steadily, since the pandemic started, our infant mortality rates here in Douglas County have increased significantly. So that is something that we are definitely going to want to look at and address. If you stay tuned a little bit later today, I believe there will be a press release with some community partners discussing infant mortality and some hopeful interventions to address that here. Some of the assets that we have in place to address infant health is our Baby Blossoms Collaborative. Right now, we are without our fetal infant mortality review nurse, who is typically the person who's heading up Baby Blossoms. We are hoping that we're going to be able to get that hired soon so that we can ensure that this work goes forward. Basically what happens is you have a case review team that's able to come together and look at those cases of infant death and look at the underlying factors that may have influenced that. And then if we have any trends or themes that are coming out of that within our community, then we know where we need to intervene. UNMC has City Match, there's March of Dimes, Omaha Healthy Head Start, and then the Douglas County Breastfeeding Coalition, which has been inactive during the pandemic, but is something that we are discussing restarting. So hopefully you'll be hearing more on that to come. Here is a breakdown of what infant mortality rates here in Douglas County look like. So this is over time. If you look all the way over to the right, you'll see the most current trends. And again, this is provisional data because our population, which gives us our denominator, isn't finalized yet. So you can see 2019, we'd been decreasing for several years, and then the pandemic started and we went up. So we continue to remain a little bit high comparatively to where we were previously. If you look at the United States and Nebraska, we are definitely much higher than we should be. Of course, you see that dotted line there, and that's that Healthy People 2030 goal of 5. So Nebraska isn't meeting that, the United States isn't yet meeting that, but we are much further from that goal than they are. This is a further breakdown by race and ethnicity, and here you're going to see a major problem, and that is that our Black babies are dying at a much higher rate than our white non-Hispanic and Hispanic population. So that means that we have some work to do in looking at health equity, looking at social determinants of health and other factors that are creating this particular health disparity. I mentioned the Douglas County Breastfeeding Coalition previously. Again, this is something that we haven't had going for the past couple of years, but we are discussing restarting this. And basically what this does is makes human breast milk available for every baby. At least that's the vision. That is what we would like to go to. So increasing the proportion of infants who are ever breastfed, increasing the proportion of infants who are breastfed exclusively, so they're not being supplemented with formula at 3 and 6 months, and then increase the number of employers with worksite lactation support programs. And there you can see the people who have previously been on that coalition. And this is what breastfeeding rates have looked like. So this is through as current as we can get it. So April of 2022. In the targets column, you're going to see a couple of blank spots, and that is because the Healthy People 2030 goals have changed and no longer include those areas, but we still think they're important to look at. So currently in the United States, you'll see 83.9% of babies have ever been breastfed, compared to here in Douglas County with WIC data is 80%, so we are lagging there. And you can kind of look down through here. If you look at babies who've been breastfed still at 1 year, the target is 54%, and we are at 16%. So there is quite a bit of room for movement there. And then exclusively through 6 months, which is really, that the big push is to keep a baby on the breast as long as possible. So 42.4% is where we would like to see, and we're currently at 10%. So you can see how important that is, especially when you think about what's currently going on in our country in terms of the shortage of formula. So it's even more important than ever to support moms in their breastfeeding endeavors.
Question.
Absolutely.
I don't hate to disrupt you, but
No, you're good.
that CDC data was 2018. So did we see a trend across the nation where it decreased with loss of breastfeeding clinic support, or is that?
That I can't answer for you, but we can find out. I wouldn't be surprised to see that decrease just because of the increased stress that the pandemic put on parents.
And health departments.
Yeah,
And
exactly.
community support.
Exactly. So that's been certainly much more difficult. WIC has been virtual for the past almost 2.5 years. So they've been serving a lot of their families virtually, which for families has in some ways been really great because you think about what it takes to get into the WIC clinic. You've got to get a babysitter for your other kids. You've got to maybe take time off work. You've got to find transportation. There are a number of barriers that can exist to prevent parents from coming in. And being able to do those visits virtually, I think in some ways has been great. However, some of that in-person support too has gone away, and so that's been unfortunately a difficulty there. So we do have a few opportunities, and I'm sure there are more than this, but these are kind of the overarching what we hope for coming in the next year or two. So restarting our breastfeeding coalition, collaborating with area health systems to explore new approaches to how we look at and address infant mortality. The UHC Pathways Hub you'll hear more about later today if you stay tuned with the media. I have a long-term vision of being able to restart home visiting for high-risk moms with public health nursing. That is something certainly we can discuss more as the years go, but this is especially looking at our current infant mortality data and what's happening, especially with our Black children. I think it's more important than ever that we have a skilled home visiting workforce that's robust and able to get out and take care of these high-risk mamas and babies. And then continuing to expand our health equity work. So obviously you saw that huge disparity between whose babies are not surviving and whose are. We definitely need to ensure that we are thinking about what are the underlying causes of these disparities that are happening and how can we address that. And happily we have a health equity team who can do that. Next, we'll talk about lead poisoning prevention. So the goal, of course, is to increase blood lead screenings in Douglas County. We want as many kiddos as possible, especially in high-risk areas, to get those types of screenings done. Conducting risk assessments and inspections in homes that have children under 7, and providing home visits to address interior lead dust in homes, and then if they need soil remediation, to work on that too. There are a number of different things that we do to achieve those goals. We have a great lead team. They are able to go out, visit homes to educate them on different things, not just dust and paint, but even things like spices that may have come into the home from other countries that may have lead in them. That's a surprising source of lead if you didn't know. And they are fantastic at working with these families to make sure that testing gets done. They also work with the EPA very closely to ensure that if we have families living in or around the Superfund sites, that testing is being appropriately done in those areas. And so you'll see that in 2021, we screened over 16,000, almost 17,000 children for lead. There were a number of cases that were over 5. So if you see over 5, that is when we typically think about doing some kind of treatment with those kiddos. There were a number of lead risk assessments that were performed, over 100 of those, 9 interior dust home visits, and then a lot of education happened. This is kind of what this looks like. So 16,000, almost 17,000 sounds like a whole lot, but it's actually a drop in the screening that we were able to do, and I'm sure no one can guess this, but it's because of the pandemic, partially. Also, there were 3 lead test recalls that impacted our ability to get kids tested as well. Here's a map for you of the number of children screened and where those children live. So you will see the east side of the county is the higher risk area, and that shouldn't be too much of a surprise since our Superfund site sits at the river. And then this is prevalent cases, so this is another number for you, and you can see 68111 was our highest zip code in terms of positive lead tests. So we have a couple of opportunities for lead as well. First of all, we're going to keep our lead program going strong. I'm very proud of that team. We're going to continue outreach efforts around lead testing as much as we possibly can. Hopefully, we have a more robust and regular supply of lead tests, so we don't have lags in testing that happen like they did here over the last year or two. And then working with the EPA to expand outreach. So there will be some numbers or some changes coming from the EPA in coming months. I can't talk a whole lot about that, but I can just say there are changes coming. We're already working with our EPA representatives to make sure that we're planning appropriately for those changes. All right, let's talk a little bit about STDs. As you can imagine, because this is a very in-person intensive service, the pandemic definitely was disruptive to our STD activities. Right now, our goal is really to reestablish those pre-pandemic STI activities, including education, outreach, and testing, increasing community awareness of where you can actually get STD testing and STI services, and then reduce rates of chlamydia, gonorrhea, syphilis, and others here in Douglas County. So I don't have an actual number goal for you on this because I think this is one of those areas where we need to sit down and have conversations about what makes sense. How much of a decrease makes sense for us to set as a target, given the fact that we have had most of our staff basically focusing on other services related to COVID over the past 2 years. So we're establishing an STI at-home testing project. So there are kits out there that you can send home with clients to have testing done. So we're looking at that. Conduct a validation study for those self-controlled or self-collected tests. Increasing the community awareness of what we're offering. And we're trying to be more modern in our use of social media, if you will. We have a TikTok now. So I encourage you to go out and find Douglas County Health Department's TikTok and like it and share it with your friends if you are a TikTok person. The educational, what do you call them? TikToks, I guess, that are out there that have been created so far are really, really cute and I think engaging for the population that they're meant to target. So we're excited about that and growing that effort. We only had about 1,062 clinic visits in 2021, and again, that's because we only opened for about a week in 2021, and then we're able to just do sporadic testing from there. So most of our staff were focused on assisting with COVID vaccinations and other efforts there. 163 people received education and outreach, and we did continue to distribute condoms as much as we possibly could during the pandemic. So those businesses that remained open and have typically accepted those, we did try to continue getting those out to the businesses that would take them. Okay, so here's what we currently look like in terms of progression or trends for rates of STI, or STD. And I am sorry if I use those two terms interchangeably, they do mean essentially the same thing. So STD is actually transmitted diseases, STI, sexually transmitted infections. Okay, so chlamydia remains our highest STI that we see, and that has not changed, and you can see that the rates for that have gone up. For gonorrhea, we've also seen those rates increase, and syphilis as well, and I think we've seen a very, very slight increase in HIV cases. So we do, unfortunately, have have a little bit of an issue that's happening in terms of STDs here in Douglas County. I don't think that's necessarily a new phenomenon. It's something that I know has been a focus in the past. So here you can see us compared to the United States and Nebraska. Clearly, we are much higher for chlamydia than both the United States and Nebraska, and continuing to increase. This is chlamydia by age group. So teenagers and young adults really is where we are seeing these cases predominantly. That hasn't changed a whole lot over the last couple of years. And then this is just a line graph of basically what you just looked at, so chlamydia rates by age group. This is a breakdown of chlamydia rates by race and ethnicity. So you will again see a disparity that's happening here. Our Black residents are experiencing chlamydia at a much higher rate than Hispanic, other not Hispanic, and white. It's possible that the other category, if we were able to tease out who's answering in that category, we could have some additional groups in here. But unfortunately, those are the only groups that we have for race and ethnicity at this time. So moving on to gonorrhea, which also is a bacterial infection similar to chlamydia, you can see again, Douglas County is winning that race. We do not have 2021 data for the United States or Nebraska yet, so that's why you see our line is a little bit longer than theirs. Again, gonorrhea cases by age group. This looks just a little bit different, so you're seeing some higher numbers that are occurring in, we'll call it approaching mid-years for these age groups. So with chlamydia, you saw those fall off pretty quickly after the 20s, essentially. Gonorrhea seems to be occurring maybe a little bit later in our age groups than chlamydia. Here again is a breakdown by race and ethnicity for gonorrhea, and you're seeing again that disparity that exists with our Black residents versus white, non-Hispanic, and Hispanic. And I would like to just also include there that a lot of these issues are related to the disparities and the social determinants of health that impact our Black community much more greatly than some other groups. I think this slide is fun because it really shows you what clinic visits did when the pandemic started. So you saw this, we were actually doing a great job getting people in and getting people tested, and then the pandemic occurred, and that dropped off very precipitously. So hopefully we're able to get that testing at a much more robust level going forward. I know our STI staff is working really hard on that. So they are doing outreach, going great guns trying to get that done. So hopefully we're gonna see our clinic visits increase significantly for next year. Finally, we have HIV rates. Here in this area, we are below the US rates, at least up to 2019, but again, we don't have data going forward for the US or Nebraska to compare to at this point, so that remains to be seen. And then this is syphilis rates. Syphilis rates in Douglas County have skyrocketed most recently. I know that our clinic staff have been extremely busy treating and managing those syphilis cases. They can be a little bit complex. So we, for a time, were not, we were under at least the US rate, and now we are exceeding it. But again, we don't have data on that for 2021. So hopefully we're able to get a handle on that and see those rates come down, but right now we have a syphilis problem. A number of opportunities that we have for really working on the issue that we are seeing with STI rates is continuing to do that outreach so that people know, first of all, that they should get tested and know where to go to get tested. This is a very sensitive topic, so we want people to feel very comfortable coming to us to get that testing done. We are also enabling prevention as much as we possibly can in terms of condom distribution, especially for higher risk individuals. And we're going to, again, try out the home kits and see if that increases our testing. these are just a few highlights from our 2021 for STD clinic. You saw all of the graphs in terms of what our rates are doing and what testing looked like. And a lot of the issues and disruptions were truly related to the pandemic. And it's been, I think, nice for our staff to be able to transition back into their outreach roles and work on that. So we were closed from December 2020 to June 2021. We had a brief reopening, and then we had to close back down essentially to address the different vaccine waves that came out in terms of age groups and boosters and things like that. And then in April 2022, so last month, we had the highest number of patients that we've seen since September of 2020. So that's good news. Hopefully now that we have our STI clerk working, hopefully that's going to help us work a little more efficiently as well.
What percentage of our testing is down? I mean, what are we at? I mean, I know we saw the graph and it's plummeted.
Yes.
Are we worried once we start ramping that up that our numbers are gonna go up?
I would not
a
be
lot?
surprised. Yeah, especially when you look at what our syphilis rates have done, even with, just kind of starting to get back into the testing game there. Those syphilis rates have skyrocketed, so I would not be surprised at all, at least initially, to see an increase in all of those different infections.
And then maybe one request, I don't know what the viability or possibility of it is, with the HIV in particular, are we comparing that and also taking in data of IV drug use? Because as we drop opioids from clinics, et cetera, they're finding other means, and that pandemic is surging, the opioids, and so I worry, is that gonna cause a spike?
It's a question that we ask, so while that's not part of my data right now, we certainly can look at that. I know that there is a lot of interest in the department at looking at opioid use, IV drug use, and things like that. It's not something that we have, at least not the IV drug use part. We don't have needle exchange programs or any health department-driven interventions for that, but at least looking at the data around that is something that we should be able to do.
Thank you.
So one of the big topics that has been a focus really for the past few years, if you've paid attention to the community health assessment and community health improvement plans, is really centered on mental health and having a trauma-informed community. So that continues to be something that we're working on, and I'm sorry, I just passed that slide. Let's see if it'll let me go back. Oh, it did. So our goals are really to increase the usage of ACEs so that we can intervene at any level when we have high ACEs scores. Trauma-informed care, really encouraging and promoting trauma-informed care across the healthcare spectrum. And then a 5% reduction in the 4-county region in reducing trauma would be great. That is definitely something that we would like to see. So you'll remember that the main focus of the Community Health Improvement Plan for this area, for Douglas County, Sarpy-Cass County, and Pottawatomie County, remains mental health. So we're going to continue working forward on that. We would love to see trauma-informed care in many more sectors other than just health. So education, first responders, in the media, the justice system. It's really a tool that can be used anywhere. And then collaboration, continuing to collaborate with Region 6 and others on resilience and self-care. There's really a need for us to take care of our house first, to make sure, if you will, that we're putting our oxygen masks on as we're looking at helping others as well. The pandemic has been very hard on everybody. There's been some level of trauma for just about everyone, whether that was losing a friend or a family member, or just not being treated well by others in the community, things like that. So there have been a number of traumas that have occurred. Of course, that's not unique to the health department staff. That's been, our healthcare providers have experienced that as well. But we find that we really need to start making sure that we're taking a trauma-informed approach to our employees. So the results of these activities have included a 10.3% decrease in mental health stigma through a campaign that was led by the Wellness Partners. which is a pretty incredible decrease there, and those efforts are going to be continuing. Over 30,000 people have been trained by Trauma Matters Omaha, so we're getting more people trained in that trauma-informed approach. And then dedicated support of our ops team, especially within the health department. So encouraging self-care, we've been bringing in people who can help us learn how to cope better and to maybe reframe our experiences, and that's ongoing. So we will continue to do that as long as we need to make sure our staff are well taken care of and then able to take care of others in our community. This is just a little look at what the trajectory of trauma and recovery looks like. So in a disaster, you typically will kind of have this honeymoon phase where everybody's on board and everybody wants to help out their neighbor. So if you remember people like in Italy out on their balconies singing to each other across the streets and stuff to make sure people felt connected, that was the honeymoon phase. Then you have a disillusionment phase where it just feels like nothing is going right. And then eventually you're going to get to the reconstruction and a new beginning. I think we're starting to enter reconstruction. However, with the multiple waves of COVID, we have hit that disillusionment phase multiple times. So even though this is a line, I would not say that this is a linear process. If you think about other similar processes like grief, you can go back and forth quite a bit before you actually come through it. So that is definitely something we're experiencing. This was a model that was shared with us by Region 6, and I think it was helpful for people to kind of see where we were and where we could expect to hopefully move in the future. Something that complicated that was just that COVID has been years long. Typically when you're looking at a disaster, it might be a few months. This certainly challenged everyone. And then post-traumatic growth is really what we want to move to for our entire community. So getting to the place where we're able to think about the traumas that have occurred within our community and to grow together from what we've learned through those processes and not to continually allow them to negatively impact us. A few opportunities that exist for us in this space include, again, aligning COVID recovery efforts with that mental health component of our community health improvement plan, incorporating trauma-informed community into racism as a public health crisis, and that is our health equity team is looking at that and involved with that. So there was the Culture of Healing campaign and then health equity and social justice workshops. Ongoing mental health support for our staff at Douglas County Health Department. Like I said, that's something that we're going to continue doing. And I am very excited to say we had a number of our staff that attended mental health first aid last Friday. So we have a number of staff who are now certified in that role. And then what we really need to look at our role in public health and what that means for addressing mental health going forward. Mental health, while I think everyone would agree, has always been important. It hasn't necessarily been a focus area for public health. And I think that's something that as we decrease stigma and we're talking about it more, I think we're going to need to be more involved in the mental health space as public health, and we really need to explore what exactly that actually means for us. I promise we won't be here that much longer. Health equity, of course, is one of our big efforts in the health department right now. Our overarching goal here is to reduce health disparities and address the impacts of racism and how that impacts people's health. Right now, as you know, we have stood up our health equity office, and we are even looking at how to expand that and to give it an even stronger role within the department. We want to create a health equity dashboard for tracking key health indicators that are linked to health disparities. So when I talk about going forward and what you might see for this report in the future, I would anticipate that there will be probably more digital resources available that you'll be able to look at anytime, not just wait for once a year for us to talk about it here. Implementing a DCHD-wide health equity climate survey and implementing an action plan, moving Board of Health declaration of racism as a public health crisis into roles, tasks, and responsibilities. So basically, that's operationalizing that declaration that you made. We have all of those 21, 22 action items that are on there. And we are looking very closely at how best to bake it into the cake, if you will. So it's not just, well, we're checking a box, we did this, we did this. We really want it to be part of our culture. So we're looking at how best we can do that. So other opportunities for health equity besides those that have already been discussed, again, embedding the major internal plans of Douglas County Health Department under the Office of Health Equity. So we have strategic plans, workforce development plans, performance improvement, quality improvement plans, and we really want health equity to be a piece of all of those things. And that's how we bake it into the cake and don't just have a box checked. We want to continue with our community connections with stakeholders and really expand into new places. We want to make sure that we're looking at health equity from every angle that we're able to, and then developing measurable and transparent outcomes that we can report. I'm going to go very fast through public health preparedness. We have had a number of public health preparedness activities over the past couple of years, including the bomb cyclone that went through, of course, the pandemic. We are working currently to do planning for the regular planning that we have to do, but also for future waves of COVID. So we will be prepared for the waves as they come. We've also had exercises over the past couple of years still, surprising, but also still nice to be able to think about and talk about things other than COVID. Of note, we have distributed over 15 million pieces of PPE, over 111,000 Binax Now test kits, 3,687 PCR test kits, over 54,000 eMed home test kits, and then, as I said, we're currently planning for the next phase of the pandemic. And here are just a few pictures that are included of our warehouse and some PPE and really what it's taken to get all of that PPE out. Surprise, surprise, COVID happened, but the other outbreaks didn't stop. So we did continue to see some outbreaks in other places. In just this year so far, norovirus has been the #1 thing that we have seen, so we continue to see that. That's kind of the 24-hour stomach flu for those of you who aren't familiar with norovirus. And it spreads extremely fast and can be pretty brutal. We've also had salmonella, hand, foot, and mouth in our daycares, which, you know, that's not something that's unexpected. And we did have one Campylobacter outbreak, which is a diarrheal illness kind of similar to salmonella. I'm not going to spend too much time on this because I just showed you our dashboard, but these are just a few metrics from our dashboard. If you don't want to go find those, you can find it in here if you'd like. And then where are we going in the future? So 2023 priorities draft. So I think we're still going to be working on those major areas that we discussed. We're obviously planning to continue to embed trauma-informed concepts into Douglas County Health Department and in the community as much as we possibly can. We're going to continue focusing on health equity preparedness. And then one area that I would really like to see is data transparency. So we do put some data on our website right now. Obviously, the COVID data is pretty robust and out there. But there are a number of health indicators that we have tracked over the years that typically have come to you in the form of like a little book. I would love to see those put onto a dashboard similar to our COVID metrics so that the community at any time can look and see very quickly and easily where we're sitting in terms of infant mortality or obesity or depression. And so I am planning over the next year to work with First of all, my wonderful data team who helped put this presentation together, and also with our GIS folks to get something built and set up. And hopefully that's going to allow us to have more real-time conversations about things and not just have to wait for, a once-a-year update. So stay tuned on more. Again, I'd really love to see home visiting return to Douglas County Health Department. So hopefully those are conversations we might have over the next year. And I think that this report is just going to look a little bit different and maybe a little more interactive and answer hopefully more questions for you as we go forward. So that is my plan for 2023. And I know that was like drinking from a fire hose, so much information. I am happy to take any questions that you might have.
Dr. Hughes?
Yes.
Let me, I've looked at these numbers so long and they haven't changed much, and I'm trying not to be disillusioned, but those numbers, especially in the Black population,
Yeah.
have not changed very much over 20 years. So, I guess I'm trying not to be too disillusioned about it. Let me ask a question, though, about prenatal care, especially as it relates to infant mortality and even STD. Do we have data that tells us, for example, when Black African-American mothers first receive prenatal care versus other communities?
We may be able to get that. It's not something that we currently track because we have multiple health systems that would be providing prenatal care. It's not something that's typically reported to us. However, with that said, I think with the advent of health information exchanges where many of us can hook into a system where we're able to pull different data, or even building coalitions or engaging our coalitions that exist maybe a little more fully, we may be able to find that information and drill down a little bit better. And I think that would be a great task for our health equity team to think about.
And
I just want to say, in the past, we've had people, we've had an opportunity to get people in, and we have seen that a correlation between prenatal care and infant mortality, and in a lot of instances, you have a lot of these young people who are already born with an STD.
Yeah.
So, I'm just wondering if there are ways that we can get around that. My second question is, that I would like to know, is the health of the Douglas County Health Department. Because this staff and you and others have taken a beating over the last 2 years. No question about it. Lives have been threatened, other stupid things have occurred. But I guess I would like to know the health of the Douglas County Health Department, because traditionally, health departments, Douglas County Health Departments, or any health department, for a number of years have taken financial hits. So I think what I would like to see at some point in time that you can do it is the health of the health department, first of all. And secondly, where we stand with, or if we can glean numbers from how many African Americans specifically are receiving prenatal care, and are they receiving it at the same time as other ethnic groups?
Right. Such good questions. We know that infant mortality goes down the earlier you can get people who give birth into care early. So if we can catch them in the first trimester and make sure they're getting appropriate and consistent prenatal care, it makes a huge impact. It's one of the reasons that I would really love to see home visiting return to the health department at some point, because public health nurses engaged in home visiting they specialize in helping to get moms into care very early. It can be a little hard to recruit in that phase because it's still a little conceptual to people who are pregnant. In the first trimester, you're not showing, you might be a little sick, but it just hasn't become real yet sometimes. And so sometimes recruitment gets easier the further into those pregnancies you go, but there are strategies that can be employed to get them in early. There are great interventions that exist to help parents learn how to parent appropriately, and in a healthy way. You know, even starting thinking about planning for that parenting before the birth occurs. And so I share your concern definitely there. And
If we're going to test, I mean, if we're going to work on a strategy,
yeah,
I mean, I think we need to know as much as we can about, you know, are they getting prenatal
Yeah.
care? Are they seeing a are they getting a doctor's or are they waiting until, in some instances in the past, they've waited till like 8 months in.
yeah,
to see a
absolutely.
physician.
Absolutely.
And I know those are insurance questions and other kinds of issues that are at play, but I think we need to know those numbers so that we can know, especially if we're talking about the social determinants of health, how many people are not getting in because of insurance, and what do we do about that?
Absolutely. I agree. And in terms of the health of the health department, I
Yeah.
can say that I would love to put together a more robust report for you and report that out. I think that the health of our organization can be looked at from many angles. I can tell you that when I came in, I expected there to be a fair amount of trauma from the health department. And so really working on the culture has been one of my primary priorities over the past 10 months. And I think that it's improving. We still have lots of work to do, and I'll be happy to report something a little more robust for you maybe in a coming presentation.
If you can, I'd
Yeah.
appreciate it. I'd appreciate this staff and you and our former director worked so
Yeah, absolutely.
incredibly hard under circumstances that should have never even existed in the first place.
Absolutely. Well, they've certainly carried the game. I just came in to bat cleanup, so
I heard a doctor say, and this came from a doctor, and I heard him say it once, and I think it's absolutely true. He said, this is not a battle between Democrats or Republicans and so forth, and liberals and conservatives. This is a battle between knowledge and ignorance, and right now, ignorance is winning.
yeah.
Those are all my comments. Thank you, Dr. Hughes.
Thank you.
I just wanted, on the maternal child health piece, when Baby Blossoms was very active, they did track some of that previously, because I was very involved in it back in from about 2010 to about 2014. And they were very active and did make some progress. And so once we can get the Baby Blossoms Collaborative back up and running, I think there are, within that there are mechanisms to track some of those, and I think it's just a matter of getting everything back stood up and
Right.
collecting. et
Yes,
cetera.
and statutorily, they I think have a little bit more leeway to look at some of that data. And then, of course, there was a legislation that includes stillbirths now into basically the fetal infant mortality review process. So that'll give us even more robust data to look at.
If I can add on that point, I think, whatever questions comes, I mean, I knew that we would have to do a reset after
Yeah.
COVID.
Yeah.
But just looking through this is kind of definitely a big reset for the department and just public health in general. I do think if the board is interested, particularly to your question, Ben, about the black infant mortality rate, I did have a conversation with Dr. Hughes about how she wanted to handle I got a request from the IB Black Girl effort and what they're doing for infant mortality. I know the board gave some ARPA money to them for that effort, and I know that there's a facility they're looking at right around 24th Street. I can work with Dr. Hughes on that, getting that presented. There's a list of things that, you know, Dr. Hughes and I have been going on after a monthly to kind of tee up, and we can add that to the list to go and see how that ties and give her time to connect with that if that's fine.
Yeah.
Okay.
As much as we can.
Yeah,
I mean,
no.
I know that there's certain data is sensitive and how you get at it, but, you know, I just in terms of trying to address two of the three areas that you talked about, STD and infant mortality.
Yeah.
And, you know, Douglas County has been high as opposed to the rest of the nation for a lot longer than a few years.
Yeah.
But If we can glean some of that, I'm looking for answers as to how we get at this. And I think there's two ways we have to do it, through our social determinants of health.
Absolutely.
Through our racial equity lens. And, you know, we need to know some data about prenatal and when they visit a doctor and how often they stay and those kinds of things. And like I said, the health department, I think one of the things that came out of COVID that people should have recognized, although I'm not sure that a lot of them have, and I think we're still playing politically silly games. But, you know, I think what was revealed through COVID was the need for a health department and a need for making sure that health department is funded appropriately and can do the things that we require of it. We just kind of sit the health department off in the corner somewhere and say, well, y'all handle STDs and all of that stuff, but they don't recognize all of the things that are done. And so, you know, I just think that a health department report would be, you know, how are we health in terms of our health?
Sure, absolutely. Thank you for that.
Anybody else? Okay. Dr. Hughes, can you, I'm assuming, can we get that presentation to the board just so they can have it? Because there's a lot of
Oh, yeah,
stuff
absolutely.
out there to pull up out of there, okay?
Absolutely.
And go from there, okay? Seeing none, let's go back up to the action items. They had a chance to get passed around. Any questions from the board on those items? Well, let me go back. Can you get us to gallery up there, somebody? Let me, Dr. Jones, if you want to chime in, I know there's trouble with the chat there, so I haven't been able to see anything on, and I got a couple of messages. So, Dr. Jones, I know if there's something you want to add in regards to a couple of pieces, go ahead and do it now.
Hey, y'all, thank you. Just wanted to give the update that yesterday, they did FDA approved the booster dose for Pfizer for ages 5 to 11. And that'll be 5 months after they receive their primary 2-dose series. So really good time to get those school-age children vaccinated with the community spread on the rise, of course. And then to Mr. Gray's question about the prenatal care, it is in the community health needs assessment. It's not broken down by race that I could tell, but it does look like at least, 1 in 4 women do not get prenatal care in Douglas County within the first trimester. So that's a huge area where we could improve.
Is that one, I'm sorry, is that 1 in 4 in general, or is that 1 in 4 in the African-American community?
Yeah, it's just that's in general, in Douglas County, it was like 25.5%.
Okay, thank you.
No problem. But again, I don't think that data is broken down by race, so that
Yeah.
would be an area we could improve.
Yeah, I think we need to see that. If you're going to attack a problem, you need to at least know what part of the problem is.
The
Exactly.
raw data is available to the health department for that community health needs assessment, and they would be able to query down by race.
Yep.
So if you have your equity epi person look at that, they can do that.
Absolutely.
Okay. Anybody else online got a question in this regard before we move on? Okay, let's go. If no questions from the board, can I ask for a motion to approve A, B, C, E, and F? Because I will need to abstain on D.
We do,
Before we do that, Chris, we had a question on E.
Go ahead.
Do we know why that's terminating? The agreement on the maternal child and adolescent school program?
Is Leah online? You want to go back up to the gallery, son?
I think she might be off, but I can find that out.
Okay. I was just a question why that's terminating, if anyone knew.
Okay, yeah, she's out, I think, for the rest of the week.
because what?
Are you
We'll
comfortable?
find out.
Okay.
We'll get back to you.
Are you comfortable with approving it, or do you want to?
No, that's fine. So
Okay.
just move to accept A through F, except, what was it, D you wanted?
Yeah.
Second.
Jeannie, you had the question? Or you?
No.
Oh, okay.
That was-
Okay, there's a motion by McNally, second by Gray. Roll call.
Yes.
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 Is there item D?
So moved?
Second.
Motion by Wise, second by Gray, and again, for the record, I'm abstaining because I'm on the board. Roll call.
Yes.
Yes.
Yes, abstain.
Yes.
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 Any questions on the report submitted by the directors?
I do.
Go ahead.
One is, first of all, kudos to the Douglas County Health Department being asked by the State Department of Health and Human Services for the STI clinics to provide education of staff on various health departments across Nebraska on various methods that are done in STI testing. So that was really good. Kudos to that department. I have just a couple quick clarification questions. In the EPI report, it said there had been a noticeable increase in percent positivity, and then that was PCR. What does PCR stand for? It was on the, on the slides earlier too,
Yeah,
but I can't,
so
okay.
the PCR test, and I should know this.
Polymerase chain reaction.
Thank you,
A what?
epidemiology people.
I'm sorry, what?
Polymerase chain
Oh,
reaction.
okay,
Yeah,
okay,
so
got it,
it's
okay.
a more
More
robust
specific,
test
okay.
than an antigen test.
There have been 7 new cases of tuberculosis diagnosed.
Yes.
Is that an increase over the previous years?
I don't know if it's an increase over the previous years. I'd have to
Okay.
check into that, to be honest. We didn't include that in our report this year. It is a high number, though, and certainly we're treating those individuals.
I think it's gone around like 14 over the years.
Has it been higher than that?
Usually
just
comes
wasn't
with
sure,
a
yeah.
refugee
Sure,
population.
sure. Yeah, that makes sense.
So, just as a follow-up, in the EPI report, talking about the CRI region planning partners, as we work to update the base plan and add lessons learned through COVID response, at some point, will the board be provided information on what those lessons learned were?
Absolutely. So that
Okay.
process is still ongoing. It's kind of a long and unwieldy process putting all of that together, as you can
Okay.
imagine.
Okay.
Absolutely, we will have a report for you on that.
Okay. My last question was, in the same report, it's talking about the PPE warehouse has begun demobilization plans. So what, I understand demobilization, but I'm trying to get a handle on what does that mean in terms of,
Basically drawing down on how long the warehouse is open for PPE distribution and things like that. We'll still have some supplies, especially as we're planning for what future waves may look like. And, we can always, if you will, remobilize. So we've actually done that multiple times with other things throughout this pandemic where, we demobilize some of our contact tracers or contact interviewers, and then we have another wave. So back when we were really, really focusing on contact tracing, bring people back in to do that. So it's just a method of preserving resources, both manpower and fiscal, when we don't necessarily need to have as much going on.
I would note to everybody, Dr. Hughes alluded to it in the State of Public Health report about the lead numbers. I'm gonna probably put that on the agenda for next month so everybody get an update on that. It's been kind of low over the last 2 years, but when the rep from EDA did come, I did have a chance to talk to her. There's gonna be some changes. I don't know if we'll be able to this month, but I do think we need to get an update on what's there, because some of those changes are gonna affect, some of the numbers that we see. It's a good change in regards to a number change in regards to what the threshold is, but, it's something we probably need to look at and see what's what. So it's a good time to get refreshed on that and where it is. So that'll definitely be on the agenda for next month to kind of get a briefing and an update on.
And that threshold hasn't been officially released yet by the
Yeah.
EPA, which is why we're not really talking a whole lot or very specifically at this point, but certainly we will talk about it when we're able to.
But if not, it's just a good idea to get an idea where we are with that and where the status is with lead, since everything has been soaked up by COVID from the last couple of years. So
Did you say the FDA?
EPA.
EPA,
Oh.
sorry, that was me. I might be hungry right now.
All right.
Okay.
With that,
I have,
go ahead.
just take a moment and say thank you for the tour that we were able to participate in with Preston Love Jr. The last couple weeks. And so I had the opportunity to attend with my daughter. So thank you for the health department for making that available to the community. It was very informative.
I will pass on your thanks to the people who arranged that. It was likewise just a really fantastic experience. And if anyone has the opportunity to do the North Omaha Legacy Tour, I certainly recommend it. It was really fantastic. Learned a lot.
With that, seeing nothing, the motion to adjourn.
Well, before that, all the retirees, thank you for your service, but especially Tim Kelso. I mean, he's been here at all the meetings. He hasn't been in the last couple, but I know he had some health issues and stuff. And then little birdie told me he's staying on to help make sure I guess my poker face needs to be worked on, because he sent me a message saying he's gonna stay on and help, so
Yes.
that puts me at ease a little bit.
There might
lot of
have been a
knowledge
little
there.
bit of panic in my heart when he let me know about his plans, and he did agree to come back on a contract basis as a retiree to help us for a few hours a week to help us transition smoothly and make sure that all of our multiple grants are where they need to be and just work his overall magic. So we're very grateful to him for that.
So on behalf of the county, thank you, Tim. So,
And just on that note, I don't know if, might want to add to the list. I know Dr. Hughes has some things in mind for some ways she's laying out some new, is it safe to say reorg to some degree? And it may be good for the board to see that once she lays it out. I think it sounds like a shock through the system to see so many people there, but you stayed through the pandemic and everybody was at a verge where they could retire, and it shouldn't be a surprise that the pandemic pushed everybody over the edge, and it was just time. It puts a lot of things in perspective for a lot of people. So, and with a lot of the things that I think we've seen in regards to the reset that needs to happen, we build from scratch to build the health department for the modern era, and their work is nowhere short of helping us to do that. So, to Tim, all of those people out there, thank you all for the work over the last 2 years and before that. With that, is there a motion to adjourn?
Motion adjourned.
Second.
Motion by Gray, second by Weiss. Roll call.
Yes.
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 See you all next month. Thank you.
Thank you.